Hello, and thank you for taking the time to learn about the Ages and Stages Questionnaire 3rd edition, also referred to as the ASQ-3. The ASQ-3 is one of the validated, caregiver-completed developmental screening tools recommended in the Louisiana Developmental Screening Guidelines, which you'll hear more about in a minute. First, I wanted to let you know a bit about Children's Special Health Services, the group behind this webinar. We are a program of the Bureau of Family Health, which is located in the Office of Public Health, an agency of the State Health Department. The Bureau of Family Health is made up of the maternal and child health, reproductive health, children and youth with special health care needs, and maternal, infant, and early childhood home visiting programs, along with a handful of other related programs. We work to advance the health and well-being of women, children, particularly children with special needs, adolescents, and families in Louisiana. The Louisiana Developmental Screening Guidelines were developed by the Young Child Wellness Collaborative, an interdisciplinary work group of early childhood experts from various agencies across the state. These guidelines expand screening recommendations beyond the domains included in the Bright Futures Guidelines released by the American Academy of Pediatrics, which include general developmental milestones, autism, and parent or caregiver well-being. The Louisiana Developmental Screening Guidelines also include social-emotional development and environmental risk. These guidelines promote national best practices and support providers with resources to build comprehensive screening services at the practice level. In line with best practices, each of the screening tools recommended in our guidelines are completed by parents or caregivers rather than providers. This shift in practice guidelines recognizes the unique expertise that caregivers have on their child's behavior in multiple settings, and also relieves providers from the time and energy it takes to administer and score an instrument based on interaction and observation. The Ages and Stages Questionnaire is the screening instrument recommended by the Young Child Wellness Collaborative for general development. Here you can see the Louisiana Developmental Screening Guidelines periodicity schedule, an easy-to-use table showing which screenings to conduct at each well child visit. The Louisiana Developmental Screening Guidelines recommend screening every child for general development at the 9-month well child visit, the 18-month well visit, and the 30-month well visit, as well as any time there is a provider or caregiver concern. From here, we'll first discuss the rationale for implementing a developmental screening initiative in Louisiana, then explore the differences between monitoring, surveillance, and standardized screening. Then we'll present the rationale for implementing universal developmental screening in primary care, cover the basics of the ASQ-3, review tools and processes for successfully implementing a developmental screening system, and finish up with a review of useful referrals and resources to use when a positive screen is identified. As mentioned previously, guidelines around developmental screening have changed in the past couple of years, and it's important that primary care providers across the state are working from the most updated recommendations. Recent data suggests that 37% of children ages birth to 5 in Louisiana are at moderate to high risk for delays in school readiness, and 42% of Louisiana parents report having concerns about their child's development. This suggests that there is a large portion of children in Louisiana that would benefit from early identification and intervention. However, less than 17% of parents in Louisiana with children ages 10 months to 5 years who visited a pediatric primary care doctor in the last year reported having completed a developmental screening questionnaire at that visit. Our goal with the Developmental Screening Initiative is to increase screening rates in primary care for young children in Louisiana so that they can receive supports and services earlier to maximize their health, education, and daily functioning. Early identification consists of 3 related but distinct components: developmental monitoring, surveillance, and screening. Each is a method of tracking developmental milestones. Developmental monitoring simply consists of parents or caregivers noticing and celebrating their child reaching developmental milestones, as well as noting when milestones aren't reached at the typical time. Since many parents often don't know every developmental milestone or when they should occur, using tools like the CDC's Learn the Signs, Act Early materials can be very helpful. I'll talk more about those tools in a bit. Developmental surveillance is essentially the same concept as developmental monitoring, but is typically conducted by healthcare or early care and education providers. To get a fuller picture, this often includes the provider eliciting parental concerns and taking a developmental history. Developmental screening involves a healthcare or early care and education provider administering a validated instrument for a caregiver to complete with standardized questions about their child's development. This is the component we'll focus on mostly today. Now that we've distinguished between developmental monitoring, surveillance, and screening, it's important to understand that each component of early identification complements the others, and that ideally we want all 3 to be happening for every child. Many primary care providers have effective procedures for developmental surveillance. For instance, building questions for parents about development into the normal flow of a well child visit. This is a great practice that can help normalize discussions around development for families and providers. However, a limitation of relying exclusively on surveillance is that while it does a good job of picking up children with significant impairments, it may miss those who have more subtle issues that might respond well to early intervention. Research demonstrates that children receiving standardized screening were referred to early intervention services 64% faster than children receiving surveillance alone. Similarly, we know that children whose parents engage in developmental monitoring and whose physicians administer developmental screening tools are more than twice as likely to receive early intervention services compared to children receiving only monitoring or only screening. All three components work best together to link children to needed resources. Here in Louisiana, 30% of children up to age 5 are at risk of developmental, behavioral, or social delays. That's higher than the percentage nationwide, highlighting the need for standardized screening to identify these children early and accurately. The next step is linking families with early intervention services. Only 4.5% of children up to age 5 in Louisiana have an early intervention plan, compared to 5.3% nationwide, suggesting that the majority of children that would benefit from these services are not receiving them. Providing quality early intervention services is a cost-effective way to change a child's developmental trajectory and improve outcomes for children, their families, and their communities. The Ages and Stages Questionnaire was developed in 1980 at the University of Oregon. The 30-item questionnaire has been validated on children from 1 month to 5.5 years old and is comprised of 5 developmental areas or domains: communication, gross motor, fine motor, problem solving, and personal social. The ASQ has been translated and is available in Spanish, French, Vietnamese, and Arabic in addition to English. It's written at approximately a 4th to 5th grade reading level. A key feature of the Ages and Stages questionnaire is that there are actually 21 different versions that are designed to be used at specific age intervals. While this may sound like a lot to keep track of, remember that most of the time you'll be administering only 3 of these questionnaires in accordance with the guidelines: the 9-month, the 18-month, and the 30-month questionnaires. The others should be readily available in the event of a provider or parent concern. Brooks Publishing also offers an ASQ-3 age calculator online at www.agesandstages.com/age calculator to assist providers with selecting the correct age interval for each child. The ASQ-3 calls for using the corrected date of birth for children up to 2 years old that were born more than 3 weeks premature. Once a child is 2 years and older, adjusted ages no longer need to be calculated. To calculate the adjusted age, subtract the number of weeks of prematurity from the child's chronological age. Let's walk through an example. Jade comes in with his mother on November 16th for his 9-month well visit. His birthday was February 4th, making him 9 months and 12 days old, which would normally qualify him for the 10-month questionnaire. However, Jade was born 4 weeks before his due date, so his adjusted age is 8 months and 12 days. According to his adjusted age, his provider should administer the 8-month questionnaire instead. The same ASQ-3 age calculator that helps providers choose the right age interval also helps calculate adjusted ages for children. Completing the ASQ-3 can be broken down into 3 steps. Step 1, have the parent or caregiver complete the questionnaire. Step 2, score the questionnaire. Step 3, share the results with the family and discuss appropriate resources and referrals. I'll go into more detail about each of these steps now. The first step in the process is to ask the parent or caregiver to complete the questionnaire. A staff member should monitor caregivers' comfort with the language of the ASQ and provide reading or interpretation assistance as necessary. Each questionnaire at each age interval is set up in the same format, so it's very important to make sure that you've chosen the correct age interval. The gray box in the top left of the cover page gives the exact age range for the screener, highlighted here with an orange arrow. This is an example of some of the questions you might see on the questionnaire. Each item has the same 3 response options: yes, sometimes, or not yet. When parents complete the questionnaire, they will select the response that best represents their child's behavior. Another aspect of the ASQ-3 is the overall section. Immediately following the multiple choice portion of the screener, this is an unscored section meant to look at the quality of different skills. It provides parents and caregivers the opportunity to voice developmental concerns about their child that may or may not come up in a typical office visit conversation. This allows the provider an opportunity to ask further questions if necessary, or explore another avenue of referral. It is important to remember that caregivers are the experts on their child and to stress that to them. Caregiver concerns are very predictive, and any concerns or questionable responses should be discussed and followed up with. Step 2 involves scoring the questionnaire. Each item is assigned a different number of points depending on the response. Yes responses receive 10 points, sometimes responses receive 5 points, and not yet responses receive 0 points. Each ASQ-3 includes the same 5 domains of development that each receive their own subscore. As you're going through and scoring the questionnaire, add up the points for the items in each domain, and record the subscore in the available space at the end of that section, shown here circled in orange. The final step is to share the results of the screen with the parent or caregiver. The ASQ has a handy tool for that. The very last page of each screening packet is the information summary page. On this page, you'll record the child's domain-specific subscores, interpret the child's results, and determine the appropriate follow-up. This page can be photocopied and distributed to parents as well. It's critical in this step to remind caregivers that screening tools like the ASQ merely identify children that are likely to have a developmental delay. They don't actually identify developmental delays. In other words, screening results are not the same as a diagnosis, and in the event of a positive screen, further evaluation is required. We're going to go over the information summary sheet in a bit more detail, as it's a key component of the ASQ. The very top of the sheet has basic information about the child, the provider administering the screen, and the date of administration. Below that is a bar graph, marked with an orange star here, with 5 different bars representing each of the domains covered in the screen. For each of these domains, fill in the appropriate subscore in the third column, where you see the green arrow. Then, plot each score on the bar to the right by filling in the circle corresponding with the score. If the score falls in the white area, it's above the cutoff, suggesting that the child's development in that domain is on schedule. If the score falls in the gray area, it's close to the cutoff and should be monitored. A score falling in the black area is below the cutoff, and the child should be referred for further evaluation. The next section provides space to transfer responses from the overall section with optional space for comments. For each of the items, transfer both the yes or no that the parent or caregiver marked, as well as the comments from the previous page. Comments can be summarized on this page if they are excessively long. This section can be a useful starting point for a discussion, particularly if you need more clarity on the caregiver's responses. Regardless of the outcome of the screen, sharing screening results presents a wonderful opportunity to engage parents in developmental monitoring and promotion. Vroom's an app created by the Bezos Foundation that provides daily age-appropriate brain-building activities for parents to do with their children. The CDC also created the Milestone Tracker app as part of their Learn the Signs, Act Early program. The app helps parents monitor their child's development by providing checklists of developmental milestones that parents can fill out at their convenience, with pictures and videos of children demonstrating each milestone, and tips and activities to promote healthy development from birth to age 5. Both apps are completely free and are available on both Apple and Android. Now that we've gone over the basics of the ASQ-3, it's important to discuss the process of implementing this and any other tool into your practice workflow. Our team at the Bureau of Family Health can provide technical assistance to any practice interested in implementing a developmental screening system. The extent and focus of our assistance is entirely up to you. We know that each practice and the communities they serve are different, and our goal is to help you create a sustainable system that works for you. Our TA request form is the first step of our collaboration. We collect information on your clinic and staff so that we can better understand how to tailor our assistance to your needs. The back of the sheet lists the types of trainings we offer and the different activities we can assist with. This form can be found on our website. One of the primary tools we encourage providers to take advantage of is our screening implementation worksheet. The worksheet prompts you to plan for 5 different areas: materials, completing the screening forms, scoring the screening forms, documenting the screening results, and patient discussion and follow-up. Many of the questions around implementation of screening programs are questions of who will be responsible for each step, which is why we ask about clinic staff composition on the TA request form. There are roles for clinical as well as administrative staff. Implementing standardized screening works best when the entire team is aware of the initiative and the various roles are clearly established. Our main take-home message is slow down to speed up. While it might seem like planning and pre-work is an extra step that you don't have time for, you really can't afford not to do it. Trying to implement developmental screening without a plan can result in confusion, extra work, missed opportunities, and frustration. Another useful tool for implementing developmental screening is process mapping. Process mapping involves the creation of a visual aid for picturing work processes that shows how inputs, outputs, and tasks are linked. While this activity was originally designed for quality improvement for existing processes, it can also be used to think through a new process as well. Once a process is chosen, the group should map out the way the work is currently being done, or if this is a new process, map out how you envision it going. Next, identify gaps and problem areas. What's preventing the process from running smoothly? Are the responsibilities assigned in a way that makes sense? Does the workflow fit with the time and space we have? Here we're going to walk through a pared-down version of what the mapping process might look like in a given practice. These 5 steps are the basics of the screening flow through a primary care clinic, and these steps might be a good place to start mapping. First, the screen is administered to parents or caregivers, then scored, then the results are shared with the parents, referrals are recommended, after which patients should be followed up with, particularly in the case of a positive screen. However, making this process fit with the flow of your specific practice requires figuring out many more details, and post-its are a great way to keep track of steps, gaps, problem areas, and solutions. For instance, one question that should come up in the mapping process is where does it make sense to have parents fill out screening questionnaires? Have your team brainstorm ideas for where this makes sense, and put the options around the question. Are there spaces where parents are already waiting around for at least 10 minutes? It may be that your practice has few exam rooms and a crowded hallway, in which case the waiting room may be a good location for this part of the process. Another question to consider is at what stage is it feasible to enter screen results into the EHR? Again, turn this question to the team to brainstorm. It may be easiest to do this as soon as the questionnaire is scored or as part of the exam room check-in. Alternatively, it may work better for the primary care provider to input the score while they're reviewing the screen results. Or it may be easiest to do this in batches, perhaps at lunch and at the end of the day. In making your decision, it may be helpful to consider who will already be accessing the EHR after the questionnaire is scored. Finally, it's important to think about who can be your resource and referral expert. This doesn't have to be somebody with specialized training. Having ready access to resources for families on early intervention programs and family support organizations will make the checkout process go smoothly and help ensure that families are linked to services to address identified delays or risks. Remember, implementing a developmental screening program is a new workflow for the clinic and will require a bit of trial and error. Don't worry if it doesn't work perfectly the first run-through. Look at the roadblocks, explore options, make changes, and retest the process until the kinks are worked through. Take advantage of our checklist and implementation tools to make this part easier. The ASQ-3 Starter Kit has a one-time fee of $275, from which each of the questionnaires can be printed and copied indefinitely. Purchasing the kit also includes access to the Essential ASQ-3 User's Guide, which provides guidance on administering and scoring the questionnaire, as well as general help with implementing a screening system and working with families effectively. The Louisiana Developmental Screening Guidelines General Development Tip Sheet contains a list of appropriate referrals and resources for both positive and negative screens. These tip sheets are also available for each of the other domains suggested in the guidelines. This can be found in the resource catalog for each region or online at www.ldh.la.gov/CSHS. Thank you for your time and interest in the Louisiana Developmental Screening Guidelines. For more information about the ASQ-3, the screening guidelines, or resources and referrals, visit our website at the link provided here, or contact our developmental screening coordinator with questions. Thanks again for serving the children and families of Louisiana.